Good evening, everyone, and welcome to BioVanguard Cell Talk presentation round 3. For today's presentation, Ananya Khan is our presenter and she will be discussing on the topic assessment of out-of-pocket expenditures on essential medicines for acute and chronic illness, a comparative study across regional and socioeconomic groups in India. Before we dive into the actual presentation, let me introduce Ananya. Ananya Khan specializes in population research, focusing on aging, the socioeconomic challenges of marginalized communities, and gender dynamics. She holds a master's in population studies from the International Institute for Population Sciences, Mumbai, and a master's in geography from Vishwabharati University, Santiniketan. Her academic background has equipped her with expertise in demography, statistical analysis, GIS, and research methodology, making her a valuable contributor to the interdisciplinary research initiatives. Ananya is also actively involved in projects addressing socioeconomic disparities and health challenges, particularly among the aging population. I warmly welcome Ananya to start her presentation.
Good evening, everyone. I'm Ananya, and today I'll be presenting a research work titled Assessment of Out-of-Pocket Expenditures on Essential Medicines for Acute and Chronic Illness. It is a comparative study across regional and socioeconomic groups in India. Firstly, out-of-pocket expenditure in healthcare refers to the money people pay directly from their own pocket for medical services such as doctor visits, hospital stays, and medicines. So, out-of-pocket expenditure has been a long discussed issue. What impacts out-of-pocket expenditure in India is the most is the socioeconomic differentials. So, substantial out-of-pocket expenditures push a large proportion of the population below the poverty line, especially those residing in rural areas having low income treatment having low incomes, and treatment of non-communicable diseases is expensive, which can be financial burden for the rural poor in India. The individuals from economically disadvantaged states in India incur higher healthcare costs for hospitalization in public health centers compared to the more developed states. Economically poor households in states such as Bihar and Odisha face significantly higher out-of-pocket expenditures for hospitalization in public health sectors compared to the economically advanced states such as Tamil Nadu. So, therefore, these vulnerable people has to incur out of pocket expenses which negatively impacts their economic well-being. They are forced to borrow from friends and family, may have to sell their assets to cope with the healthcare payments. Further, the medicines and outpatient care contributes to their impoverishment, and eventually it can push these economically disadvantaged people below the poverty line. Medicine constitutes the significant portion of healthcare expenditure, and previous studies shed light on the challenges of out-of-pocket expenditure on healthcare, specifically access to medicines. The provision of low-cost generic medicines is suggested as an effective way to escape out-of-pocket expenditures, but it has not has been effective so far. As an easy accessibility of medicines, basically the easy accessibility of medicine would require following favorable conditions like public sector commitment, adequate public sector financing, efficient distributions of medicine, low taxes, and a culture of rational use of medicines. A study done by Castor and Mohanty provided disease-specific out-of-pocket expenditure data. Using the National Sample Survey Organization 71st round data, they showed that the mean hospitalization cost for diseases where cancer incurred the highest out-of-pocket expenditure, and which was followed by cardiovascular diseases. And this phenomena is particularly true for underdeveloped states in underdeveloped states in Odisha. There is a need to protect vulnerable populations from financial hardships in India, particularly in the state of Odisha. The study aims to analyze out-of-pocket expenditures on medicines in Odisha, comparing households through wealth index and demographic factors. So, the study has picked 6 districts for the survey. Namely, the districts are Kalahandi, Raigada, um, Angul, Khorda, Kenjuar, and Kendrapara. So this is a cross-sectional household survey which has 6 districts, and the sample size is 902 households with a multi-stage cluster sampling design, which has a stratified random sampling procedure. And the survey has been taken place between October 2021 to February 2022. Uh, the the districts have been stratified in the following ways. So the Raigada and Kalahandi has been chosen because they are tribal area and are economically poor, where the population is vulnerable to healthcare services. Angul and Keonjhar are industrial region which has a better economic condition, and Khorda and Kendrapara are coastal and capital regions with better economic conditions with a high per capita income. So in the sampling, the among the 902 households, um, some of the blocks have been selected based on various criteria that I have talked in the previous slides. In the study, so basically, there are the dependent variable here in the study is the share of medicine in total monthly household expenditure, and the independent variable is the wealth index, occupation, social groups, medicine expenditure categories, regions, localities, illness, which includes chronic and acute illness, and health insurance coverage. So the study reveals that the share of medicine expenditures to total expenditure was highest among poor households, whereas which is 36.4% compared to the wealthy households, which is 12.3%, which who faced extreme medical expenses. In terms of occupation, households engaged in farming are more vulnerable to high out-of-pocket expenditure, which incur 24.5% of their total expenses. High share of medicine was recorded in the north, and high share of medicine was recorded in the north and South Odisha, whereas not a single household from coastal Odisha faced extreme medicine costs. However, the households in South Odisha faced extreme medicine expenses greater than other regions. Households with acute illness had higher medicine expenses, that is 21.8%, and moreover, only 14.7% of households with chronic illness paid high amounts of medicines. According to the unadjusted odds ratio analysis, wealthy households were 0.246 times more likely to spend more than 50% of their total expenditure on medicine than poor households. Plus, the rural urban disparity shows that the urban areas are 0.102 times more likely to face the effects of a high percentage of total household expenditure. So the present study contributes to and extends the field of out-of-pocket expenditure studies by putting together acute and chronic illness with household expenditure. It provides a perspective of looking at out-of-pocket expenditure from wealth index categories with a selected geographical region. Considering wealth, expenditure categories, social groups, geographical location, rural urban factors, and acute illness in the model, wealth expenditure categories emerged as the significant factors contributing to medicine expenses in a household. The rural urban divide regarding the share of medicine in total household expenses is still very visible. A study done by Vasudevan shows that the rural areas are more prone to higher out of pocket expenditures than urban areas. However, the gap has narrowed in the current era, as indicated by the present study. Uh, Acute illness may contribute to high medicine expenditures in the household budget. However, chronic diseases have no such relationship with the household budget. The data reveals that the socioeconomic inequality exists in the population. It has direct implications for access to medicine and health. Out-of-pocket expenditure has different effects on the three wealth categories of households. A wealthy household can cope with high medicine expenditures, but middle class and poor households easily break. Uh, can easily break down due to the burden of medicine costs. The rural areas, regional differences, and acute illness are prompts to act to control out of pocket expenditures in medicines immediately. Policy framing and scheme formulation are continuously taking shape to improve access to medicines and minimize out of pocket expenditures in Odisha. The schemes need to be improved on the on first central front, which has long been highlighted in many studies, and this study also highlights the same issues, that the policies needs to be reframed, and the and there need to be some work done with the regional inequalities and regional disparities. So the present study again reveals the capital regions are well protected against out of pocket expenditures on medicines, but tribal areas are still underserved. So the odds ratio reveals a critical positive association between high out-of-pocket expenditure and poor economic status in households in Odisha. So the association must be minimized or nullified for equitable economic and social development. Thank you so much.
Thank you, Ananya. Thank you for your presentation. Audience, now the floor is open for any queries. If you have any questions, you can type in the chat box. Okay, Ananya, we have one question from Numair. How can policymakers use this research to make better policies?
I think it can help around the coverage of health insurance, and health insurance coverage can like the how we can have better health insurance for people. The study shows that yeah.
Okay, thank you. Yeah, thank you. So I think that's it. No more further questions. Thank you, Ananya, for your presentation. And I thank everyone for attending this LGOG presentation. And I hope to see you in the next presentation. Thank you so much.